All right, let's now talk about pneumonia plus COVID-19 pneumonia. We use ultrasound to diagnose the COVID-19 before the COVID test was available to everyone. All right, so first physical exam finding for pneumonia, we have a patient with a tachycardia, fever, rales. That is about between 4 to 30% sensitivity with just physical exam. If you add X-ray for pneumonia, then that is about 46 to 77%. And chest X-ray miss rate for pneumonia is about 35%. Ultrasound, it's about 81 to 100% sensitivity, which is amazing. And here is a studies and here is a podcast that you can listen to. So what position and what ultrasound probe should we be using? Yes, we would be using cardiac probe. And we're going to use a patient sitting up and using posterior or lateral to diagnose pneumonia. So what are the pneumonia findings on ultrasound? So lung tissue appears hypoechoic, wedged shape, and poorly defined. Air bronchogram are hyperechoic with the consolidation, parenchyma, and enlarged with respiration. So every time you breathe, you can see the consolidation getting a little bigger. And hepatization, meaning that the lung looks like a liver, and shred sign. So here is hyperechoic consolidation with numerous small hypoechoic consolidation with numerous small hyperechoic structure and blurred margin. Here, if you look closely, this looks like a liver, so hepatization, and here is very bright white lines that you can see. That is actually called lung worms. It's dynamic air bronchogram. So it's an air stuck within bronchi, which is obstructed, and this is very specific for pneumonia. Do you guys see this white line coming in and out? It's called lung worms and dynamic air bronchogram, as you can see here as well. And pneumonia with parapneumonic effusion and shred sign. So parapneumonic effusion with a shred sign. And that is what you will find in pneumonia. How about COVID-19? COVID-19 pneumonia is just slightly different than bacterial pneumonia because this is a virus and they like to stay more peripherally. So here are more podcasts if you like to listen and learn more. And this is pleural line, and this little dent, we call it subpleural consolidation, and this we will likely see in any virus pneumonia, especially in COVID-19 pneumonia. And these are the findings that we normally find in COVID pneumonia: pleural thickening, patchy B lines, and subpleural consolidation.